Healthcare workers in the Nelson Mandela Bay are pleading for government to intervene as crime gangs continue to target health facilities. It's not a new trend. Criminals have been targeting clinics for years now. However, the situation has reportedly intensified. And our reporter, Sipha Kema, is in one of these hotspots. Sipha, it seems like every time we cross to you, you're in another place where crime is a massive issue. You were at schools in the region a few days ago, looking at how they're being targeted for crime, everything from hijackings to school robberies. And now we're talking about this phenomenon in the healthcare sector as well. The trouble is, it's not new.
That is so true, Iman. I mean, as you're talking about this, it's a trend. Crime seems to be a trend in the Nelson Mandela Bay and a serious problem, not just for the communities at large, but obviously targeting places like schools and healthcare facilities. That's when you know that it's a real crisis. And of course, the department is also suffering, other than, of course, the community, as we heard earlier on when we spoke to a community member who had actually requested us to hide her identity out of fear that the local gangs might target her when she speaks out. So that you can just imagine, and I mean, we had to move from one clinic that we were in KwaZakele to a safer or somewhat safer area, because in those areas it's not safe. It's definitely not safe, and patients are not safe as well. And I'm going to bring in the department spokesperson, Sizwe Kupelo, and he's going to tell us more about this and how this is exactly affecting the department as well, Iman. I mean, having to replace medication, having to replace equipment, but also patients are at risk here in these healthcare facilities because of crime. Now, Mr. Kupelo, we've spoken to you, I mean, regarding the issues that are faced by some of the clinics in the Nelson Mandela Bay. Crime is a major problem, but I think let's start off with, how much is this costing the department? Is this, quite costly for them, having to replace equipment and healthcare medications?
Well, we are gravely concerned about the situation. Yes, it is costly to us. The recent incident was when in one clinic thugs came in and took the entire perimeter fence, and we had to act promptly to replace it, because as these incidents occur, we also face a challenge where our staff members would refuse to perform duties raising safety concerns. So we've got to work and respond promptly as these incidents affect us. But we've got strategies in place now. We're working with local leadership, the councillors, and recently we met with the mayor, who has committed to assist the department in addressing the problem, because we've got to ensure that we don't allow this to bring health services on to its knees.
Now, I mean, this has been a trend that has been ongoing for a number of years in the Nelson Mandela Bay, where we see healthcare facilities and your clinics closing down for months or days, or, as you mentioned, healthcare workers refusing to come into work out of fear. So it's been years now. What is the new plan in place in regarding security, regarding the way forward? Any collaborations that the department is looking to make with law enforcement? Because, I mean, when we were there at the two clinics, we were not seeing any vehicles, police vehicles patrolling the area.
Well, we have identified red zones or hotspots, and when we go to those areas, we've got an agreement with the SAPS that they will provide escorts to ensure safety of our staff, especially when it comes to emergency services. But in terms of strengthening security on our side, apart from warm bodies that we have contracted to guard our health facilities, we've also now introduced panic buttons and also contracted a company that's providing electronic security systems.
And just one more question, Mr. Kupelo. Talking about those warm bodies, I mean, we took a tour and took a drive around in some areas, clinics in Sais, KwaZakele, and I mean the infamous Lunga Nyobose in that area. That's a real hotspot where we had to leave. But we only seeing 2 security guards with batons at the gates. How are they supposed to go up against armed thugs that go in the numbers?
Well, that issue would need to be discussed at a central government level, because in South Africa, health facilities are regarded as gun-free zones. Therefore, we cannot arm our security personnel. So it's an issue that needs to be discussed at that level. However, the company that's been contracted is providing electronic security system and also armed response as and when an alarm is raised. But this issue needs a community as well to work with the department, hence our collaboration now with the municipality and SAPS to try and strengthen. But I need to mention that if a community of Gqeberha decides to gang against health workers, that's going to cause serious problems for the community. So it's vital important for the department, for the communities to stand up, work within the law, work with the community police forums and the department as well as the police in trying to put a stop to what is happening, because it is threatening their lives.
All right, so thank you so much, Mr. Kubelo. That's Mr. Kubelo, the Department of Health in the Eastern Cape spokesperson, telling us some of the issues that are affecting, these healthcare facilities. But not only that, at the back of it, Iman, it's affecting the department itself, having to replace equipment, replace infrastructure and resources, but also having to comfort healthcare workers, obviously, and trying to ensure them of their safety during these tough times to come into work, because we know that there's been protests and stayaways by healthcare facility workers saying that their lives are at risk.
And it's not, again, unique to the Eastern Cape. Sipha, we've seen it in other parts of the country as well, where people who are even looking for tenders, for example, we heard from Nehau just the other day, are coming into the hospitals and assaulting medical and nursing staff because they're not getting, certain contracts. So the situation is really out of control. Again, another area where decisive leadership is needed. Sipha, Kema and the team, you be safe out there.